Hi, my name is Hindery, and I am a program manager for the Child Neurology Foundation. Today, I'm going to talk about the Neurology Social Services Network and give you a high-level overview of the program. Today, I want to talk about what the network is, what our vision for the network is. I will not be providing a Unitas demo today because it is a private platform. However, we do have community events where we give a demo of the platform, or you can reach out to me at any point in time and I can schedule that with you. Then we'll talk about next steps if your organization decides to join the network. So what is the network? The network is a group of 30 different organizations coming together to find social services for families. What we wanted to find out here at CNF is what our families need as far as social services go and what they're not getting. So several years back, CNF started hosting peer support workshops. And the feedback that we received was that people know how to help other families, but what they don't have are the tools to support them. So when a family asks for some sort of social service, a lot of organizations were taking a lot of time and Googling to try to figure out where those social services were for the families. We called ourselves professional Googlers here at CNF. You may have some of those as well. And people were just sort of getting discouraged by having to do this. They also didn't know whether when they referred their families to an organization, whether that organization was going to provide the support that we thought they were going to provide. We didn't know if our families were landing in warm hands that were going to take care of them. Instead, we were just sending our families off into the void. And so CNF said, what can we do to make sure that we know our families are getting taken care of? Also, what kind of social services are our families in need of every single day that they're searching for and not getting? And how can we get those resources to our families? And so we went searching for a technology platform because we know that technology and innovation are very up and coming, and we would probably be able to find something that could help us connect our families to these social services. And we landed on a platform called Unitas. Unitas is a closed loop referral system. And the reason why we decided to go with Unitas, and I'll explain more about what that platform is, but it was mainly because we would be able to collect data about our families and the social services that they need. Unitas allows us the opportunity to aggregate the data from those 30 organizations on the back end. Now, again, this is de-identified data. Everything is private. This would allow us to be able to collect that data and then advocate at the local and national level for our families to get them these resources that they so need. We would also be able to connect our neurology organizations together and provide that support and wraparound services in a coordinated and organized way. So we knew that our families were going to be able to get the support that they needed and that they were going to land in those warm hands that I talked about before. We here at CNF truly believe that if we work together as a group of organizations, we are going to make such a bigger and broader impact. Our mantra here at CNF is rising tides lift all boats. So if we work together instead of as individual organizations, we can make a much, much bigger impact. So our pilot that is happening in this next year or two is going to be based on the Unitas platform, which is a social service referral network that refers families both locally and nationally. So we can find social service organizations for a family in their local community, but we can also look at the national level and down to be able to find families exactly what they're looking for. These 30 plus organizations that join in 2022 are going to have the ability to refer these clients to all the social service organizations in this platform. In this platform, we have hospitals, we have housing organizations, food shelters, transportation, there's legal help, there's pretty much any social service that a family is looking for, you can find. There's respite care as well, which our families often so desperately need. In 2023, as I said before, we are onboarding 30 plus organizations. In 2022. In 2023, we are going to expand that to up to 100 organizations. And again, aggregate that de-identified data on the back end. Each organization will have the opportunity to get their own organization's data, as well as the data from all of the organizations combined by the end of the pilot. CNF will then host quarterly conversations to share out that data and discuss how we can leverage using it on a local and national level, how we can advocate at the policy level for our families. Now, the Unitas Network is free to any community-based organization. The part that is not free for the Child Neurology Foundation is the data. So collecting that data on the back end and aggregating it is the part that costs. For us, they charge per state, which is why we have decided to pick 30 states where we can aggregate that data together. These 30 states were chosen based on these factors listed here. The states that had the most established Unitas network, the highest numbers of partners in the Unitas network, the states with the highest Medicaid or CHIP population, the top states that are served through our CNF peer support program, and then the states with the highest access for neurologic care conditions. The states in blue are the ones where we will aggregate the data. The states in the darker shade, like Indiana and any of these states in black, are the ones where we would not be aggregating the data. However, you can still refer families in these states. They are just not the states where we're aggregating the data in. So you can still help families in all of the states by the end of 2023. I'm sorry, by the end of 2022. There is no price for your participation in the network. At the beginning of this program, because it is so costly to aggregate that data, we were going to charge organizations 0.33% of their annual revenue. And we quickly realized that that is just not doable for a lot of organizations, especially when it wasn't already budgeted the year before. And so here at the Child Neurology Foundation, we are more interested in helping our families. So we have decided to shoulder the cost of aggregating that data on the back end. We are just asking for partners to help us in that and ways to help our families as a community. So I will be able to refer families to your organization if they reach out to me and fill out my form. So together as a community, we can build a much bigger network. I will be sending a contract, however. Usually we think that there's a price point associated with the contract, but there will not be when I do send you a contract if you agree to join the network. The contract just basically says that you will allow us to aggregate your de-identified data, you'll use the system appropriately, and that it will cost you nothing. So that is something that I will send to you if you, again, decide to join the network. So what about next year? So the goal of our pilot is to support a thriving and successful network for the neurology community. In 2023, CNF is going to roll out the network, as I said before, to up to 100 other organizations. The bigger the network, the more we can advocate as a large community. Here's how Unitas works. You can log into Unitas from any browser and see which families filled out an assistance request form. Our assistance request form here at CNF is our contact us form, which a lot of organizations already have. And that contact us form connects directly to Unitas. So you are not responsible for filling out any family data, any demographic information. The family already does that through the contact us form on your website. Then the family also gives consent through that form as well. So that's a big piece of the Unitas platform, is giving that consent. You will then get an email saying that you have an assistance request. You will log into Unitas, browse the map to find the specific social service your family is looking for. You can look at the different organizations and what services they specifically provide. Then you can choose one. Once you choose an organization and refer the client that way, and it's just a simple click, the organization will then get an email that says you have an assistance request waiting. That organization can then decide to accept the referral and help that family. Then you will get an email stating that they've accepted the referral. They can also decide to reject it. Reasons they might reject it is their funding has run out, or something along those lines. You will get an email saying they've rejected it. You can go back into the system, choose another organization to refer that client to. The organization can also say, you know, I can't help this family, but I do know of an organization that can. And they can then forward that referral to another organization that they know can help them. Again, you will get an email. So that's what we mean when we say a closed loop referral system. You are tracking your family throughout the entire process, all the way until the case is closed. So we know our families are landing in warm hands. We know they're getting the social services that they need as well. They're not just falling off into the void. So that is a little bit about the Unitas platform. If you would like to schedule a demo to go over and to kind of see the platform in action, you can contact me at any point in time. Once you get the demo and you decide, yes, this is definitely something we want to be a part of, I will send you a contract to sign. Again, the contract simply states you owe us nothing, that you agree to have your data, your de-identified data collected on the back end, and that we will notify you of the quarterly conversations that we will be having, and that you agree to use the platform appropriately. Unitas will connect you with Unitas, and they will work with you to set up and connect your Contact Us form to their platform. They are wonderful along this process. It's about 4 to 5 weeks, depending on your availability as an organization, and they will train you completely on how to use the entire system. Then you can launch. So that is how the whole system works. You can contact me at Hindery at childneurologyfoundation.org if you have any questions about this process, if you would like to schedule a demo, or have any other needs. Feel free to contact me at any point in time. Thank you again for joining this community announcement event, and I look forward to hearing from you soon.